Hi, everyone, and welcome back to Renegade Healer. I'm sorry for those of you who've been sort of waiting. My last post was a while ago, and I had promised to come back tomorrow to talk about our next topic, and I've been very, very slow, so I apologize. But this is just going to be a short little chat today, and I'm going to remind people that there's no need to watch if you're trying to avoid extra screen time. Just close your eyes and listen. I'm not going to be putting any words on the screen or showing any diagrams or anything. I just my last post, I sort of spoke about kind of working with your practitioner and building a relationship and considering their perspective and advice, as well as asking them to consider your own. But the flip side of that people have brought up many times in their kind of messages or comments or conversations that I've had, is that sometimes you're working with a healthcare provider that doesn't really seem to know much about concussions, head injuries, post-concussion syndrome. And that's a reality, and that's a tough one. So I wanted to offer a few thoughts on that. And the first thing, probably most importantly, obviously in every area that where various people that are watching these videos live, there's going to be some discrepancies in what's available to you. I live in a rural area in Renfrew County, Ontario, in Canada, and I have been recovering from my injury for over a year, and I still have not seen a neurologist. My wait list, our wait list here for my referral was 14 to 22 months. So I've been working with my practitioner, and she's been excellent, but I'm also having to work with a lot of independent information gathering and other healthcare providers who have some experience as well. So kind of that's what I wanted to talk about. I wanted to talk about what can you do, because our doctors are all just human beings. They're all just doing the best they can. Some of them have information and knowledge about head injuries, some don't. Some have their own opinions about the realities of post-concussion syndrome, and not all of them are going to be really necessarily easy to work with, between what they know, what they believe, and just their personalities. So what do you do? One of the first recommendations that I would make is that you start asking for referrals. If your doctor is really easy to get along with, then that shouldn't be a problem. If they're not super easy to get along with, if there's a little bit of maybe a strong ego or a stubborn kind of desire to be your sole caregiver, asking for a referral is a very kind of gentle way of bringing somebody else into the team. So somebody of another discipline. So that may be a psychiatrist. And that sometimes is a hard thing to ask for personally, because we still carry a lot of stigma around mental health, and we don't always want to go down that path. But just because you consult a psychiatrist doesn't mean that you're necessarily having to embrace any sort of diagnosis. You're just seeking somebody else who may have some different opinions and understanding about the journey of recovery from your injury. So, and also may have some very valid suggestions and recommendations, and ultimately you're looking to heal, so why not, right? So asking a medical practitioner for a mental health referral can be a very wise way of advocating for yourself and building your team. Obviously, asking for a neurology consultation is also very wise. And sometimes you can ask kind of just in the form of questions and being curious, asking if we were, example, to have an MRI or a CT scan, what might we see, and would that be useful? And is there anybody else who could kind of help me understand that? So you don't have to necessarily be in any sort of power struggle. You can just be a curious participant in your own care and ask for these things. So that's one recommendation, one thought. Another is just for you to, if you can, if you have the resources, engage other practitioners on your own. So some examples, your optometrist, eye doctor. Sometimes there's visual effects. Or even if you haven't had any symptoms, you can have a discussion with your optometrist to find out if they are knowledgeable about head injury and would they share any resources or information. A chiropractor, same deal. Asking for some treatment, asking for evaluation, just asking for information and direction. A physiotherapist is another good resource. An occupational therapist, a speech pathologist. You can approach a naturopath, an osteopath. All of these disciplines have the potential to introduce you to somebody who knows about head injury. And all of these people in helping professions are candidates to take an interest in you and want to help you. So there's no harm in asking. Even if you don't have the funds for ongoing treatment, be bold, call around and just ask. Say, this is my situation. I'm looking for some help. I'm looking for an ally. Would you talk with me? So I want you to kind of think about what's in your community and what's available to you. And then going back into the doctor's office, often I have been shocked by when I share with people that I'm recovering from a head injury, how many people know someone who also is recovering or is suffering with post-concussion syndrome, and they are really wanting to help connect, because so many people have that shared experience of feeling really lost and isolated and poorly understood. And so kind of everybody sort of knows somebody who has post-concussion syndrome. And I think there's also a shared experience of not necessarily always being believed. Sometimes we doubt what we cannot see, right? Validating each other's experience by connecting, but then also kind of collaborating on and sharing what we've learned. It's the whole point why I'm making these videos, really. Sharing what we learned, and then you can carry that back into your doctor's office. You say, I've met a few people who are also recovering from concussions, and we've been talking about our experience, and they have a lot in common with me, and they've been working with, or they've been given this information, and I was looking at it, and it really seems to fit for me. Would you talk to me about this in conversation with your medical provider? Would you look at this information and consider running these tests, consider offering me this prescription, consider this referral, whatever it may be. But again, it's about being kind of humble and kind of gentle, so that we're not ruffling each other's feathers, but still being assertive and trying to not be a passive kind of receiver, but more an interactive part of your recovery and your building your relationship with your healthcare provider. So again, it's very brief today, but I just wanted to sort of start you thinking about if you're feeling lost in the relationship with your doctor, and you feel your doctor doesn't really know what to do with you. How can you take some action to find out, and then bring the caregiver along with you? So, and I guess that's maybe that should be my last point, is that you may find, and in fact, I think most people will find, that you're going to need an ally sometimes, a friend, a family member, a counselor, somebody who may speak on your behalf to also reinforce and validate your concerns. It's an unfortunate reality that that is necessary, but it is often necessary. So think about who can you engage to speak for you and to support what you're saying. So that's it for today. I hope you're continuing to rest well. I hope to bring you a few more posts in the next few days.